Welcome to today's video, where we'll explore the 7 key signs and symptoms associated with fatty liver. Make sure to stay tuned until the end, as we'll also discuss the steps you can take to reverse this condition. Before we proceed, it's essential to clarify that this video is for educational purposes only and does not provide medical advice. We are not medical professionals. Let's start by understanding what fatty liver disease is. The liver plays a vital role in our body, performing various functions such as nutrient metabolism, bile and urea production, toxin elimination from the blood, and storage of certain vitamins and minerals. However, when the liver accumulates excess fat, it triggers an inflammatory response. This leads to the attack and damage of liver cells by antibodies. As a result, the damaged liver cells are unable to function properly, hindering the liver's detoxification process and its other essential tasks. Consequently, more fat continues to accumulate in the liver, causing a condition known as fatty liver disease or hepatic steatosis. Fatty liver is the most prevalent form of non-alcoholic fatty liver disease, NAFLD. While small amounts of fat in the liver are harmless, exceeding 5 to 10% of the liver's weight becomes concerning. As the liver becomes increasingly fatty, it can lead to fibrosis and cirrhosis, the advanced stages of liver disease characterized by severe scarring that is irreversible. Now that we understand the risks associated with fatty liver, let's delve into the 7 signs and symptoms of this condition. Number 7. Elevated liver enzymes in the blood. The liver plays a crucial role in metabolizing various substances such as nutrients, drugs, toxins, and byproducts of metabolism. It produces enzymes, namely aspartate aminotransferase, AST, and alanine aminotransferase, ALT, which serve as indicators of liver damage. Research indicates that a significant percentage, ranging from 25 to over 50%, of individuals with fatty liver disease exhibit elevated levels of AST and ALT in their blood. These increased enzyme levels can serve as a potential warning sign of fatty liver disease. If you've been diagnosed with non-alcoholic fatty liver disease, NAFLD, we encourage you to click the link provided in the video description. It will lead you to a comprehensive 4-week plan designed to promote liver health and recovery. Number 6. Weakness and fatigue. If you find yourself lacking motivation for physical and mental activities, experiencing muscle weakness, or constantly feeling tired, it could be due to fatigue associated with fatty liver disease. A study conducted in 2008 found that patients with fatty liver disease reported higher levels of fatigue. This is not surprising considering the liver's crucial role in energy metabolism. The liver acts as a communication hub, interacting with various systems in the body, including the skeletal system, intestines, nervous system, and adipose tissue, where fats are stored. However, as fat accumulates in the liver, this communication network becomes disrupted, leading to impaired functioning of muscles, intestines, and nerves. Consequently, weakness and fatigue can arise as a result of this compromised communication and disrupted energy metabolism. Number 5. Edema and abdominal pain. The accumulation of fat in the liver leads to inflammation of liver cells. This inflammation triggers an immune response, with immune cells attacking the affected tissues. Consequently, tissue damage can result in fluid retention, leading to edema. If you experience edema, you may notice swelling in different parts of your body due to fluid buildup. Additionally, individuals with fatty liver disease might also experience pain or discomfort in the upper right side of the abdomen, where the liver is situated. It's worth noting that another potential cause of abdominal pain could be the presence of bile duct stones. These stones can develop as a result of fatty liver disease, further contributing to the discomfort experienced in the abdominal area. Number 4. Appetite and weight loss. In cases of liver damage, particularly during the advanced stage of fat accumulation, the normal functioning of hunger-regulating hormones can be disrupted. One such hormone is leptin, which plays a crucial role in appetite modulation and reducing food intake. However, when leptin levels exceed the normal average, it can result in a loss of appetite, ultimately leading to unintended weight loss. Therefore, individuals with fatty liver disease may experience changes in their appetite, often feeling less inclined to eat, which can contribute to noticeable weight loss. Number 3. Gastrointestinal issues. Gastrointestinal issues encompass problems related to the organs of the digestive system, including the mouth, stomach, and intestines. A study conducted in 2019 examined the gastrointestinal symptoms experienced by patients with liver cirrhosis. The findings revealed that the most frequently reported symptom was abdominal bloating, affecting almost 50% of the patients. Additionally, 13.3% of the patients experienced diarrhea, while 8% experienced constipation. These symptoms further highlight the impact of liver-related conditions on the proper functioning of the gastrointestinal system. Number 2. Nausea and acid reflux. A 2009 study demonstrated a higher prevalence of gastroesophageal reflux in patients with fatty liver disease. These individuals also reported increased incidence of heartburn and belching. Gastroesophageal reflux refers to a condition where stomach fluids flow backward into the esophagus. This can lead to symptoms such as nausea and vomiting. Another factor contributing to these symptoms is the inability of the liver to effectively eliminate toxins and waste products. As a result, these substances can cause damage to the mucosa of the stomach and esophagus, leading to acid reflux and its associated discomfort. Number 1. Bruising and bleeding. The liver plays a crucial role in producing platelets, a type of blood cell responsible for clotting and stopping bleeding. However, in the advanced stage of fatty liver disease, known as cirrhosis, platelet production can be significantly decreased. When the blood is unable to clot effectively, it can lead to symptoms such as bruising and even bleeding from minor injuries. Additionally, individuals with fatty liver disease may also experience jaundice, yellowing of the skin and eyes, itching, and swelling. To recap, these are the 7 symptoms associated with fatty liver. If you notice any of these symptoms, it is advisable to undergo a blood test, ultrasound, or biopsy to assess your liver function accurately. It's important to note that while medical interventions can provide support, healing fatty liver disease ultimately requires making necessary changes to one's diet and lifestyle choices. By implementing appropriate diet and lifestyle modifications, individuals can effectively address this man-made disease and promote liver health. Now, let's explore 8 essential strategies you can implement to prevent and reverse fatty liver disease. Number 1. Regular exercise. Engaging in regular aerobic exercises, such as walking, running, cycling, or participating in activities like Zumba, can have a positive impact on fatty liver disease. These exercises promote fat burning in the body, which can help reduce the accumulation of fats in the liver. Additionally, they can contribute to decreased synthesis of fats within the liver, further supporting the reversal of the condition. Number 2. Limit alcohol consumption. It is crucial to limit alcohol consumption to prevent and reverse fatty liver disease. Alcohol is a significant contributor to fat accumulation in the liver. When alcohol is metabolized in the liver, an enzyme converts ethanol into a harmful compound known as acetaldehyde. This toxic substance is not only detrimental to liver health but is also considered carcinogenic, meaning it can increase the risk of developing cancer. Therefore, reducing or eliminating alcohol intake plays a pivotal role in the prevention and reversal of fatty liver disease. Number 3. Consume fiber-rich foods. Including fiber-rich foods in your diet is essential for preventing and reversing fatty liver disease. Fiber has the remarkable ability to lower blood lipids, including triglycerides and LDL cholesterol, often referred to as bad cholesterol. To increase your fiber intake, aim to incorporate a minimum of 5 portions of fruits and vegetables into your daily diet. Additionally, include other fiber-rich foods in your meals, such as beans, lentils, and gluten-free whole grains. Number 4. Reduce sugar intake. Cutting out or minimizing sugar consumption is crucial for preventing and reversing fatty liver disease. Sugar consumption can lead to weight gain and cause spikes in blood glucose levels, particularly in individuals with prediabetes and diabetes. Elevated blood glucose levels contribute to fat accumulation in the liver. To effectively reduce sugar intake, it is advisable to avoid refined sugar, commercial fruit juices, and packaged foods and snacks that often contain hidden sugars. Number 5. Avoid high fructose corn syrup, HFCS. Cutting out or minimizing high fructose corn syrup, HFCS, from your diet is crucial in the prevention and reversal of fatty liver disease. HFCS is considered equally harmful, if not worse than regular sugar. When the liver is exposed to large amounts of fructose, the excess fructose is directly converted into fat, leading to fat accumulation in the liver. To effectively avoid HFCS, it is important to read nutritional labels carefully and steer clear of packaged foods that contain this ingredient. HFCS can also be disguised under different names, such as glucose-fructose syrup, maize syrup, tapioca syrup, fruit syrup, and crystalline fructose. Number 6. Maintain a healthy weight. Maintaining a healthy weight is crucial for preventing and reversing fatty liver disease. Even a modest weight loss of 10% can have a significant impact on reducing fat accumulation in the liver and contributing to the turnaround of fatty liver disease. Number 7. Minimize medication usage whenever possible. The liver plays a vital role in eliminating toxins, waste products, and metabolizing drugs within the body. To support the health of your liver and aid in the reversal of fatty liver disease, it is advisable to avoid unnecessary medication whenever possible. Excessive use of medications can put additional strain on liver cells and exacerbate the inflammation associated with fatty liver disease. Number 8. Maintain a balanced diet. One of the most critical aspects of preventing and reversing fatty liver disease is maintaining a healthy and balanced diet. Since the liver is responsible for converting food into energy, any excess carbohydrates, proteins, or fats are converted into fat in the liver, leading to its accumulation. To support liver health, it is important to include foods that aid in detoxification, such as cruciferous vegetables, artichokes, turmeric, walnuts, milk thistle, and coffee. Now, let's discuss who is at risk for fatty liver disease. Individuals who are obese, over 50 years old, have a family history of liver disease, suffer from sleep apnea, diabetes, high blood lipids, or consume alcohol in excess, over 14 drinks per week, are at a higher risk of developing fatty liver disease. If you have been diagnosed with non-alcoholic fatty liver disease, We encourage you to click the link below to learn about the 3 pillars for maintaining outstanding liver health and discover a 4-week plan to rejuvenate your liver function. If you enjoyed this video, please show your support by liking, sharing, subscribing, and clicking on the bell icon to stay updated with our future content. Now, we would like to hear from you. What measures do you take to keep your liver healthy? Please leave your comments below. We value your input.